What is metformin?
The oral antihypoglycemic drug, metformin, works through various mechanisms. Firstly, it decreases the uptake of glucose from the intestine. Secondly, it improves the receptor sensitivity to insulin, and thus, it increases the amount of glucose transported into adipocytes and skeletal muscle cells. Finally, metformin suppresses the hepatocyte glycogenolysis, and so it decreases the amount of glucose transported from the liver to the blood.
What exactly metformin do? Metformin lowers your blood sugar levels by improving the way your body handles insulin. It's usually prescribed for diabetes when diet and exercise alone have not been enough to control your blood sugar levels. Metformin is considered the first line of defense for people with the condition, as it is safe, effective, and affordable. It is not linked to weight gain, and it puts very little stress on the internal organs. Mechanism of action: decrease hepatic glucose production, decrease intestinal absorption of glucose, increase insulin sensitivity. Generic name: metformin. Brand name: Formitin. Classification: biguanide or anti-hyperglycemic agent. Dosage: 500 mg. Route: per oral. Who should take metformin? Contraindication includes hypersensitivity to metformin, chronic heart failure, impaired hepatic function, diabetic ketoacidosis, severe renal disease, abnormal creatinine clearance resulting from shock, myocardial infarction and lactation, adjunct to diet to lower glucose level in patients with type 2 diabetes, adjunct to diet and exercise in type 2 diabetes as monotherapy or with a sulfonylurea or insulin, polycystic ovary syndrome, antipsychotic induced weight gain. Side effects: headache, loss of appetite, abdominal discomfort, blurred vision, hair loss, anxiety. Side effects: adverse effects: altered taste, upper respiratory tract infections, allergic reactions, hypoglycemia, vitamin B12 deficiency, peripheral edema. Benefits: metformin can do much more than treat diabetes, and researchers continue to study so that it can help treat other conditions. Metformin can help with weight loss and reduce the size of your waist. Metformin can also improve fertility. It even helps people with certain medical conditions live longer. Metformin can improve fertility for some people who have trouble getting pregnant. Metformin prolongs lifespan and improves immunity, but in humans, things aren't as clear-cut. Researchers think metformin decreases the risk of early death from certain medical conditions, including diabetes and heart disease. Metformin can help people with obesity reduce their weight, even if they don't have diabetes. Metformin can decrease your risk of developing diabetes. Studies show that people with diabetes who take metformin have a lower risk of dementia. But right now, there's no evidence that taking metformin prevents people from developing dementia. So the bottom line, metformin has many more benefits beyond its first use in the treatment of diabetes. More and more studies continue to find additional benefits for metformin. In the future, healthcare teams may use metformin to treat and prevent a number of conditions, including dementia, cancer, and COVID-19. Metformin confirms that plays an important role in the success of the combination therapy. The rational use of metformin and sulfonylureas together with insulin will help to improve metabolic control in type 2 diabetes patients who have secondary drug failure. Thank you. Presented by Christine Echevarria.